Basically lasers are devices that augment some certain wavelength of light that targets a specific thing in the skin. When you choose an office or a facility that does a lot of different types of lasering, you always have to take in consideration, did that office just buy one laser to try to treat everything? Because that's always the million-dollar question. You can buy a platform device which has different heads you remove, and it can treat different things. So you might have a head you paid $50,000 for that treats red spots, and then you take that off and put a new device handle piece on that paid another $50,000 to treat brown spots. And so people will make those purchases and have really one laser with different heads. And so in an ideal scenario, you want to have probably multiple different lasers that target different things. I think you tend to have a better outcome, reproducible outcome with multiple lasers as options. And it gets very confusing for patients because, again, you just kind of go into an office and think, can't you just laser that spot off? Well, if that office has a laser but they only have a pulsed dye laser and they want to laser off a brown spot, it's not necessarily the best laser. Now, some people will still say, well, we can still do it, but their outcome's not as good, so patients' satisfaction is decreased. An example would be one of the lasers we use from a medical side is called an Excimer Laser, which is basically a laser in the UVB light range that we use for essentially two different treatments, and both are medical. We use it for treating psoriasis. So it focuses treatment on specific areas on the body, so small body surface areas that are somewhat challenging to treat. We utilize that laser also for vitiligo patients, so patients that lose pigment. Another laser we utilize in our practice here, which is probably viewed more as a crossover laser, where we use it for medical and for cosmetic treatments, would be a pulsed dye laser, which is a laser. This laser is 595 nanometers, which is a yellow, that's the visible yellow light wavelength, and that color targets red. So we use that for treating a lot of vascular or blood vessel growths. Another laser we have here that is a more common laser, I believe we were, if not the first, one of the very first in the triangle to start using fractionated laser. So we use the Fractal system. We have a couple different variations of it. That's essentially a laser that will target water. It targets essentially water, which you're going for heating up the skin, and you're trying to heat up for fine lines and wrinkles. Depending on the settings that you do with the laser, you can actually target very superficially and cause that skin to slough off and reduce a lot of their pigmentation. So brown spots, conditions like melasma would be a medical condition you can treat with that laser. So there are different angles of devices. These would all be considered lasers that we would use. Another laser we'll use commonly would be an Indy-YAG laser we'll use for the little blood vessels you see on the sides of noses or on your cheek that just don't go away with a pulsed dye laser or a couple other device options, and you can't really inject them. So that's a nice targeting laser for those little vessels, and that's actually a fairly rewarding treatment because you watch those vessels just disappear with that laser. Hair laser is a very, very common thing we do here and a very common thing in dermatology and in the laser community as a whole. And there's several different types of hair lasers, several different hair laser manufacturers that are on the market. And essentially they're all doing the same thing. They're all marketed differently with the way they cool the skin and their pain threshold and the size of the lesion, spot sizes you're treating, etc. But for the most part, they essentially are doing all the same thing. It's more marketing than anything. There are other devices out on the market. You'll see intense pulse light therapies. We have an IPL in the office here, and that we generally use on the cosmetic side. And then there's always things that can go wrong in laser sessions. The energies could be set too high, and you can burn a patient. We'll get patients that come in that have been blistered from hair lasers or from being in fractional treatment. Sometimes you can see some result scarring from a laser. Those are low risks, but they do happen. Anytime you're heating up skin, you do run a risk. You can have skin gets too light after lasering and skin gets too dark. Those would be probably the more common side effects with lasering would be lightening the skin too much, darkening the skin after laser treatment, scarring, which would be low risk, but scarring, infections can happen post-laser. The outcome wasn't not expected. Patients are dissatisfied because they got overpromised on what the laser was going to do. Blistering, which often can result in some scarring. Those are all risks that always are going to be present with the laser. Again, if you're going to somewhere where people have properly been trained and they know which lasers are proper to use in this situation, and the settings are, properly guided and directed, risk is fairly low. But that's, again, that's where the trust comes into the selection of where you're going to get your lasering done. And here we tend to take that as a very high priority, as making sure that everyone is properly trained, devices are upkept properly, and we're treating them with the right device. And not, if we don't have the device that can't work for you, we're not going to treat you. We would refer you to maybe somewhere else that has the proper device that we'd have to use. So those are all aspects that you need to take into consideration when you're looking at laser therapeutics.